Hi everyone, Dr. Nemechek here with this week's viewers' questions. Quick reminder, hit subscribe so you can stay abreast of all our new postings. And if you have any particular questions I'm not touching on today, put them in the comment section and I'll be sure to get to them in the next day or two. So first question we have is, can I use protocol with my son even though he's been fed by a J tube for the last 5 years, from between 1 and 6 years old? Can this help his intestinal tract? So for all of you that don't know, a J tube means a jejunostomy tube, and the jejunum is this middle part of the small intestine. And so they'll put a tube here and put feeding in there, and typically they might have short bowel syndrome or just short bowel failure that sometimes happens, or even you might call it failure to thrive, or the child's just not eating. And we've had a couple cases like this in children. We've had a couple cases in adults, and they're able to tolerate the protocol just fine. The protocol was actually just put into the tube. We actually tend to have very positive response. And I had looked back in our records, and we've had 3 kids with J tubes. One completely, after about a year, no longer needed it anymore. And the other 2 were partially not needing it, were starting to feed again and so forth after about a year. They're making a lot of progress, and then we just lost them to follow-up. And so and I have adult cases where all the adults came off the J tubes after a period of time. It's not just a few months. And the adults, I think most of those were like 1.5 to 2 years to get enough recovery they could eat, and their intestinal tract was functioning normally. So yes, the protocol can work and is tolerated well by these patients. Second is, why don't you use breath tests to diagnose SIBO, and which medicines, and to use breath tests, I think they're meant for determine which medicines to treat SIBO. Well, the breath tests, they can be wrong like 30 or 40% of the time. It makes it almost impossible. When you're using it for an individual, it makes it very hard. When you're using it in a big study with like 100 people, statistically you can kind of account for that, okay? They're just bad tests. And I'm very end result oriented anyhow, so we know what kind of bacteria. It tends to be Klebsiella or E. coli that are overgrowing. Most doctors can use in the short term. You can use Augmentin, Cipro, levofloxacin, but you really can't use any of those in the long term. And so that's why I tend to go with rifaximin. It's safe over the long term, and it pretty much controls everything. Sometimes we might get a little archaea overgrowing, and you can look at one of our other videos about that, and I might use some metronidazole or neomycin with that. It's just practically, if you know what you're doing, it doesn't matter. It doesn't really guide you if you use your brain a little bit, okay? So we get great results without it. I could just say that. Another patient, I keep relapsing a few weeks after I finish a 14 course of rifaximin. Why does this happen? Why is this? If you take a course of rifaximin and you get a positive response, and it doesn't last long. Now, positive response, I'm talking about just like intestinally, like bowels are better, less bloating, my heartburn went down, I'm not reacting to food as much. And now, if your gut is working fine, like good motility, and you don't have some other event happening, you can go many months, maybe years, without a relapse. But the patients who come to me, typically, they've been sick for a while. They all have a lot of autonomic dysfunction, and a part of that is slow, small intestine motility, and they will relapse fast. So to this patient, I would say, you're relapsing fast. It's typically due to autonomic dysfunction, and my approach is, I'll do like a 4-month run of twice daily rifaximin minimum before I'll try taking them off and see how long they could go. So, all right, next question from Rick. Helping my son's constipation daily with Miralax has almost completely stopped his aggression. So I'm assuming his son has autism. I'm afraid of giving you Miralax for a long time. Is it safe? Yes, it's very safe. Very, very safe. Especially if somebody's aggressive or has elopement or things like that and all the danger that can happen there. But really on a practical level, though, when you're using the protocol, the constipation issue will get better, typically, a few to several months, and then you won't even need it anymore. So it's not like he's going to be on Miralax forever, I promise you. Just make sure you do the full protocol, follow my instructions, and pretty soon the constipation, the neurological issues causing the constipation will recover and they'll do better. Rebecca, why do you prefer to use Midodrine for focus issues instead of stimulants such as Adderall and Ritalin? And again, this is in context of kids with autism, and that's because kids with autism, they have horrible tolerance to Adderall and Ritalin. All those stimulants cause all sorts of symptoms in these kids. And the main benefit from Adderall and Ritalin is it boosts blood pressure to your head. And the ADD is better because you get better oxygen. Well, so does Midodrine. But unlike Adderall and Midodrine, Midodrine doesn't get in your brain and cause direct side effects. The kids tolerate it so much better. So much better. That's my reason. Now, if somebody's 16 without autism, Adderall and Ritalin are fine. But with autism, they just have tons and tons of side effects from that stuff. And then last, can your protocol help me with my joint pain and rashes that worsen when I eat? Boy, oh boy, can it. This is a classic sign of leaky gut, and that whenever you're eating particular foods or just foods in general, and you're going to get leakage of these macromolecules from the food and bacteria and yeast and stuff, it increases leaky gut right into your immune system and gives you flares. So the inulin can help. I have video coming out about inulin and rheumatoid arthritis. It can help just right there with that. But I think a better response is getting rifaximin, and then don't forget to treat your potential COVID leaky gut with glutamine, and there's videos about that. So that's all for this week. Send in your questions. We'll answer those, and I'll see you next week on Viewers Questions Answered. Take care.